Today we are going to talk about next generation Nclex scoring models. And I know we have some information already available in our website. I have prepared this with examples from our question bank, AppleRN question bank, and you will be able to see how the scoring system is, right? It will be very helpful for you to understand the process altogether. The resources which are available, one is in our website and it's under the blog. And there is one detailed information about what are the scoring methods, including some of the examples for each one. And this is our question bank. And each question, when you do in our question bank, as you know, we have like 3,000 plus questions. And each question, you will see there is a scoring method given there. It says here rational scoring. So the scoring will give you, and it will give you an idea about what kind of question is this. And this is 0-1 scoring. So each one you will know when you're doing the questions, you will understand what kind of scoring method is used. It is given for every question in AppleRN question bank. And these are the main 3 scoring methods which you will see. Whatever kind of questions you are getting for the current Nclex RN exam, there are 3 kinds of scoring. As you probably know, the NGN is Next Generation Nclex RN exam, which started in April 2023, right? So before that, there was not, this kind of scoring was not there. There was only one kind of scoring, which was either you get 0 or you get 1. But here, there is partial credits and also there is negative marking. So we have to be careful about how to answer them. So these are the 3 scoring methods. The first one is the age-old 0-1 scoring. So this is what we had before, just 0 or 1, which means if you get an answer correct, you get 1 point. If you get an incorrect answer, you get 0 points. I mean, makes sense, right? Very, very straightforward, clear cut. And our normal multiple choice questions will come under that, like 4 options, like most of your priority questions, which probably have 4 options and you have to select one of them. And if you get it right, you got the point. If you didn't get it, you don't get the point. So that is the multiple choice, which we are very used to in most of the cases. We do a lot of multiple choice questions. So that's one of them. Then matrix multiple choice, that I will show you how that looks. Multiple response, select N. This is like select all that apply kind of, but it's not select all that apply. There they will tell you how many you have to select. So in this question, there may be like 5 options, 6 options, 7 options, but then it will tell you there are 4 correct answers, so select 4. Or it will tell you there are 3 correct answers, select 3. So it will tell you exactly how many correct options are there in that big number of options. So that one is select N. This is our SADA, the age-old SADA, where you have to select all that apply question. That is not 0-1 scoring. That has negative marking, right? And drop-down close, table, drag and drop close, and bow tie. So these are some of the ones which are in 0-1 scoring. I know these names are kind of new probably, but we have done a lot of questions in each of these areas. We have completely covered all these kinds. So if you go through the webinar sessions, if you go through the question bank which are there, it will show you examples from or many questions from all these kinds. And also this is the partial credits one where there is negative marking, and that's the rational scoring where everything has to be correct to get the point. So let's look at one by one. First, we are going to go into 0-1 scoring, or how does that work? And in this one, this is our, again, just examples of what kind of format which we use. So multiple choice, this is kind of a multiple choice question. In fact, we can take a little bit of time to answer this. So that way, it's not just the scoring method. You are able to learn something too. And we may not be spending a lot of time explaining this like we usually do in our class. But because I want to talk about the scoring methods more, but this is one of the examples. So an 84-year-old client is admitted with congestive heart failure. The client has an advance directive DNR in place. Family is at bedside. While performing morning assessment on the client, the nurse notices the below rhythm on the monitor. What is the best nursing action? Number 1, assess the client to cough and deep breath. Number 2, draw the curtain and provide privacy for the family and client. Number 3, initiate rapid response team. And number 4, administer oxygen. When we did the ECG class in the CVS session, what did we say? What will be our first question? Is it regular or irregular? And this is irregular because you can see this is the base here, and this looks even longer. And if you look at this is different. This is more. This is more. So this is not regular, right? This is irregular. So if this is irregular, what kind of, and I have told you about that, if it is irregular ECG and you cannot really see the P wave, it's kind of fibrillating. There is no definite P wave where you can see, like the P wave should be like that, right? So we don't see that. So this is AFib. Yeah, this is atrial fibrillation. Very good. This is not a sweetie. This is atrial fibrillation. So if this is atrial fibrillation, now that was one part you have to figure out. Now we are applying that to the question. It's an 84-year-old client. It's DNR client. So if this is an atrial fibrillation, what are the things we can eliminate, right? Do we assess for cough and deep breath? I mean, those kind of things we do for probably, SVT and all. We ask the client to cough and things like that. But one is not going to be something we are going to do for this client when they are having, AFib, right? That's not going to be helpful. And draw the curtain and provide privacy looks okay, but it's not really doing anything for the client with this ECG. Like the second option is not something which will help the client, not doing anything with the question, with the focus of the question. So 2 is out. Initiate rapid response team? Probably not, right? That's not something we will do when there is DNR clients and is having something like AFib. We might end up asking for help if the client is having symptoms. Just because they are having AFib doesn't mean that the client is declining right now. Maybe they already have a history of AFib. We need to do the assessment first and see what is going on. And is the client having symptoms? Is it something new? Is the client already getting some medications for that? So there are lots of things we will be doing probably before even asking for help. So what is the ultimate answer we have in this question? And this is from our notes. We have discussed this. When there is atrial fibrillation, the treatment part is going to be, we are going to give oxygen. We might end up giving anticoagulants. I'm not sure about cardioversion in this client because we may have to talk to the client and see if they want to do that. So that's going to be something a physician will be, introducing the client to the procedure and consent and things like that. But right now, what we can do to help this client who is having this atrial fibrillation is to administer oxygen, right? So our answer is going to be the fourth one. Yeah, so that's how you are going to eliminate all the options. Identify, focus, eliminate. Do not rush into taking the answers because this is, like we said earlier, this is a 0-1 kind of scoring, which means either you get it right and you got the point or you don't get it and that's gone. So unless you are saying 4 is the answer, you are not getting any points for this question. This is the matrix, matrix multiple, which you have probably saw earlier in our scoring time. We said matrix multiple choice. So this is the matrix multiple choice we are seeing here. Okay, so look at that. So what are your answers? And in this one, the nurse is evaluating several clients in the antenatal clinic. So this is from the maternity. Match the pregnancy signs from the following as appropriate. Each option can be used only once. You will be able to select only one for each row. So for amenorrhea, either you can click here in presumptive, or you can click here in probable, or you can click here in positive. You will not be able to click here and here. Okay, you won't be able to do more than once. And this is the answer. This is how it's going to be. I'm not explaining the answers because this has already been covered. And I just took it from the AppleRN question bank. So all of you can go back and really go through each of them. So I'm not spending a lot of time explaining that, the questions right now. Our focus is on learning about the scoring models, right? So you can see an amenorrhea only in presumptive. I won't be able to click here. If I click here, this will automatically go because I can select only one in a row. And Bastion his contraction is a probable sign. We have talked about presumptive, probable, and positive sign in detail in maternity. And I really, really would like you to go through it. And it's in lesson 5, go through the maternity. And then these are beautifully explained in simple terms there. So it will really, really help you. So here, what happens is, if you get right, you get 1 point, right? So it's 1 point is for each thing. So let's say if you got amenorrhea 1 right, you got 1 point there. If you got Bastion his contractions as probable, if you got right, you get another point there, right? So it's either 0 or 1. So let's say if you have, your answer was, let's say one of them is wrong, like you didn't put that. Instead, you clicked on presumptive. And let's say you didn't click this. Instead, you clicked here. Okay, let's say this is what you got, right? So in this one, you got 1 point there because this one was right. So you got 1 point. Here, you didn't get any point because you got this one wrong. So it's either you get a point or you don't get a point, right? So in this one, you didn't get a point. So you got 0. Fetal heart rate, you got it right. So you get 1 point again. Positive pregnancy test, you got it right. So you got 1 point again. No, sure. Okay, this one you got wrong because you selected positive, but this was supposed to be presumptive. So you get 0 points. This is right, this is right, this is right, this is right. So there is 1, 2, 3, 4, 5, 6, 7 points you got out of 9. So you will be getting 7 out of 9. There is no negative marking here. It's just like any other multiple choice. Each row is considered as its own. And you get either 0 or 1. Now let's look at another question, right? This is where I would say, just read the question and see how you see that. The client is diagnosed with Alzheimer's disease and went home with spouse. Few days later, the client was returned to the clinic by spouse who found her wandering in the street away from home. Select 4 useful strategies that can be used by the spouse to prevent wandering of the client. So here, this is what is called multiple response select n number. There are 8 options, but it tells you there are 4 of them which are right. This is not our usual select all that apply question. Number 1, initiate 101 supervision of the client. Number 2, add a motion sensor alarm to the doors. Number 3, ensure that the client wears medical alert bracelet with contact information of the spouse. Number 4, place the door locks below eye level of the client. Number 5, add a curtain to cover the door to make it unrecognizable. Number 6, attach a tracker on the jacket used by the client. Number 7, use childproof locks for all exits. And number 8, which is keep an extra key for the house hidden outside for emergency use. This is again from our question bank, and in our neuro Alzheimer's disease session, we talked about in detail about this. Also did a webinar on this. This is the answers. We are looking for only 4 of them. Number 1 is not required because it's not possible for the spouse to just sit at home and have a 101 observation. There is a possibility that the client may be alone. So this is a client with Alzheimer's disease. This is not, we are not talking about someone who is suicidal, right? I mean, suicidal ideation clients or someone who is having that, actively having that thoughts are the ones maybe we will think about the one-on-one supervision, but it's not possible for the spouse to be always there looking at the husband or the wife all the time. I mean, that's not going to be possible. And sometimes the client may be alone. That's why we are not taking that. Second one, adding a motion sensor alarm to the door is a good one, because whenever the client is trying to open the door, or whenever the client gets there or trying to fiddle it out, it will make a noise, some kind of noise, or alarm the person. So that way the spouse will be able to get there and stop the client from wandering off. So that's going to be a good thing to do. So 2 is good. The medical alert bracelet with contact information, very good thing to do. This is something we would say an Alzheimer's disease patient may probably need it, especially they have the history of wandering off. So if someone spot the patient, they at least know whom to contact, right? That's a very good thing to do. But our question was asking on preventing at the first place. We don't want the patient to get out or wander off at all. So this one is good after they do that, to get them back. But our question was focusing on how can we prevent it in the first place so that they don't leave. So that's why 3 is not going to be our answer. Even though it's a good thing to do, for our question in this session, it's not going to be the correct answer. Now, that's something you will have to remember about Nclex. There may be a lot of good things and good options and right answers. You feel like it's the right answers. Those will be there in your options. But you have to be smart. You have to be very confident, and you should be able to critically think and eliminate some options, even though they are really good things to see or good things to do, because they are not focusing on what the question is asking right now. It may be a good option for this question. It may not be a good option for the next question, even though both questions are talking about the same disease condition, right? So be very, very thorough about that. Now, the fourth one is good. Place the door locks below the eye level of the client. And that is like, when you're going for it, you usually just try to, like on your eye level, whatever you see, you try to open it. But if it is just a little bit below, they may ignore it. That way they won't get out. Okay, so that's the plan. Add a curtain to cover the door to make it unrecognizable. Yes, because they're not really able to think, and they don't have the insight and the judgment when they reach a certain level of Alzheimer's disease. The dementia, the neurocognitive things will take over, right? The deterioration or the degeneration is going to be so profound that the clients are not able to make that right decisions for themselves. That's why it's even important for us to protect them. They are the loved ones still, right? They are our loved ones. So we need to protect them. We need to ensure the safety of them. And this is one of the things we can do to make the door unrecognizable, so that, because if you do that, if you see the door and the door is right there and the handle is there, they will try to open without even realizing what they are doing. But if it is not recognizable, they may not try it, right? That's prevention. Attach a tracker on the jacket used by the client. Again, this is kind of the same as this. It helps us to track the client when they are outside, or if they are lost. We can, there are several trackers now which are available. Like we can monitor that on our cell phones now, and the signals will be there. There are kind of GPS enabled things. So we will be able to locate where they are. But again, it's not going to prevent them from going. It's only helping us to get them after they are gone. But our question is about prevention. That's why we are not taking 6 as our option, right? Then use child-proof locks for all exits. That's a very good thing to do. And if you are like me, I really struggle with child-proof things, when especially even opening a little pill bottle or the doors or the cabinet doors, I have so much trouble when it is like child-proof. Sometimes when I go to other houses where they have little children, they have these child-proof locks and stuff. It is so hard. And so it will be very helpful so that the patients won't try to open that easy and go, right? And keep an extra key for the house. Again, it's really good to have an extra key outside the house, because sometimes, let's say the spouse went outside for some grocery shopping, or maybe for work, and maybe he had some meeting. So when he comes back, what if the dementia client or the Alzheimer's client is not able to open the door from inside? I mean, it's locked. So how is this person is going to come inside, right? So it's always better to have an extra key. That way you always have access to get into the house, even if the client who is inside is not able to open it for you. So that's a good thing, but it's not going to prevent them from wandering off, right? So what are the options here? Now let's look at the scoring here. So let's say if you have got these answers right, it says like we have to think about 4 of them, 4 useful strategies. So let's say you got 2, 4, 5, 7, right? Then you got the point. And maybe you got 4 points because there are 4 of them, right? So it depends on how the computer is scoring, right? How the difficulty level and what kind of question was that. So maybe you got 4 out of 4 because you got all of them right. Now let's say you selected this one, you selected this one, you selected this one, and you have selected this one. Okay, there were 4 of them, and then these are the 4 options which you have selected. By the way, when you are doing these kind of questions, the computer will not allow you to select 5, because once you try to click one more, it will give you a pop-up. It will not allow you to select more than 4, or whatever the question requests you to take. If it says select 3, it will only allow you to select 3. So let's say you selected these 4 options. Now, how is your points going to be? You're going to get 1 point here. You are not getting any point here because that was a wrong answer. You will get 1 point here. You will get 1 point here. And even though you did not select the right answer, you will not have there is no negative points. You will get 3 out of 4. So now we are going to talk about a little bit of troubling one. This is called plus minus scoring. This is where you will have, good thing is that we will have partial credits, but we will have negative marking too. Right? This is our selector that apply matrix multiple response, not matrix multiple choice. The one we did with maternity, the presumptive sign, the probable sign, that was matrix multiple choice. This one is matrix multiple response. So there is a little bit of difference. Even though they look like table format, it's a little different, and I will show you how they are. And that one will also have, plus minus scoring, which means you get credit, partial credit, if you have some right, but you also lose points when you have something wrong. All right. So this is going to be one of the select all apply questions. So let's say, let's do this together. And again, this is from the question bank. You have it available. A client has been scheduled for a polysomnography. Which of the following client statements would indicate an understanding of this study? Understanding of this study means we are looking for something good, right? We're looking for something good. Okay, so what would you say are the good things? Now, this is a select all that apply question, right? It doesn't say how many right answers are there. It doesn't say what are the 3 things which are good, or what are the 4 things which are good. It doesn't say that. It just says select all that apply, right? So in this one, because of plus minus scoring, we have to be careful. Now go ahead and see and let me know what you think is the answers for this one. Number 1, I will be spending the night at Sleep Study Center. Number 2, I should not have any caffeine before coming to the test. Number 3, I should not take any naps on the day of my test. Number 4, I can wash my hair with shampoo before coming for test. Number 5, I should wear comfortable clothes like pajamas. Number 6, it is okay for me to bring my own pillow. Number 7, I should not take any medications on the day of the test. And number 8, during the test, I can sleep in any position I want. All right, so let's see. I'm going to a little bit of information. Polysomnography is sleep study, and we know sleep study is done in most of the time it will be done, ideally it will be done in a sleep center, study center, right? And then the patient is going to spend a night there sleeping, but they will be connected with all these monitors, and it can be a little, you know, anxiety provoking when you think about all the electrodes and all the signals, and that somebody is watching you. So usually the technician and the doctors will explain and make you comfortable, and you know, you just sleep, and they will monitor you, and really helps to identify sleep apnea and narcolepsy or restless leg syndrome. So those kind of you know, studies are really helpful to identify these kind of problems. Couple of things we say is we can bring anything we want, like anything we want, meaning not alcohol or anything. Okay, not that. I mean, you cannot smoke or you cannot drink. Don't take any alcohol, any kind of caffeine or stimulants which may disturb the sleep. So avoid that. But it's okay to be on your nighttime clothes, like, you know, PJs or you know, any kind of comfortable clothes you use for sleeping, you can use that. And if you want to bring your own pillow, it's fine, because, you know, some people have that habit of they need their own pillow, or sheets, anything like that. Patients are welcome to do that, because ideally we want them to sleep just like they sleep during, you know, at their home, so we can monitor them. Medications, though, we would say don't skip any scheduled medications, and ideally they should be talking to the doctor and see what medications has to be taken and what not. We will never say don't take any. Okay, so because if they are hypertensive or diabetic or hyperlipidemia or heart failure or something like that, if they are on some medications or any mental illness medications, if they are on something, they should take it. Right? So it basically depends on a one-on-one basis, case-to-case basis. So they should talk to the doctor. And something we say is avoid naps, because if they take naps, especially in the afternoon, and then they may have a hard time sleeping during the night. So that's something we would say. And also don't put any hair oil or gel, because they have to put all these electrodes, and it may not stick properly. And that's why we ask them not to use any things like that. But it's good to take a shower. Actually, it might help even for sleep, even better sleep. So okay to take a shower, okay to shampoo, that's fine. Yeah, and they can have any position they want. I mean, even though there's a lot of wires and stuff, like the connections and stuff, it's still enough room to be on the side, or, you know, sometimes people do twist and turn a lot during the sleep, and it provides for that much, you know, allowance is there, so it should be okay. Good. Okay, so let's look at the answers here. The answers for this question is going to be, I will be spending the night at sleep study center. Yes, this is correct. This is correct. I should not have any caffeine before coming to the test. Yes, we don't want any stimulants. I should not take any naps. Good, because if they take naps, then they may not sleep okay. I can wash my hair with shampoo. Yes, just don't use any gel or stuff like that. So this is good. Oh, we are looking for understanding. So we are looking for something good. Okay, something good. Okay. I should wear comfortable clothes. Yes, you can wear your PJs. It is okay for me to bring my own pillow. Yes, that's fine too. I should not take any medications. That's not okay, because I don't want to say I should not take any medications. They should actually take scheduled medications. And so that's why we are not selecting that. During the test, I can sleep in any position. Yes. So this is a select all that apply question, which ideally, if you are someone who did this, then you will be getting 1, 2, 3, 4, 5, 6, 7 points out of 7, because there are 7 correct answers and you got all 7 right. Right? So you got all the points. Now let's say somebody they didn't check that and they checked this. Okay. Let's say this is what someone's answer was. So what they get is This is right answer, so they get 1 point. This is right answer, correct answer, so they get another point. This is also correct. They get another point. Okay. So they got 3 points. For most, total is 7. They got 3 points. They did not check this, so there is nothing. Okay. They did not check this, so there is nothing. They did not check this, so there is nothing. But they checked this and they got -1 because that was a wrong answer and they selected it. So what happens is, out of these 3 points which they got, they lost 1. So the total points for this person is going to be 2 out of 7. Even though they got 3 of them right, because they selected one which was incorrect, it's negative marking. So they should have, I mean, if they didn't select this, at least they should have got 3 points. But now they ended up with 2. So that's the thing about select all that apply question. So in this select all that apply questions, I would say stick with what you really, really know. Please don't do any guesswork. Ideally, you should be really good in all the content which we have been talking about. You should be, without skipping any videos, you should be watching all the video lessons in AppleRN course, and you should be doing all the questions so that you don't have to worry about any guesswork at all because you're prepared well. Now, in case, let's say, you get to a point where you're not sure about something and it's a select all that apply question, don't choose it. Just stick with what you know, because you don't want to risk your good points with the negative points, which might come up if it was a wrong one. So in this one, there is a 63-year-old female who came to the ED with severe headache and vomiting that started 2 to 3 hours prior. She also has severe pain on the right eye, right eye, eyebrow, and cheek. She's nauseated and vomited twice since feeling the pain. She has noticed blurry vision from right eye and rainbow-colored halos around the lights. Denies flashes and floaters. She uses prescription glasses for reading. Smoker since age 20. Drinks alcohol on occasion. Denies any illicit drug use. History of diabetes, degenerative disc disease, and seasonal allergies. And she is taking medications for that. So that's kind of a scenario. Now, the question, the matrix multiple response is like this. So this might look like the maternity one, which we did, matrix multiple choice, but this is matrix multiple response. Okay, so here you can select more than one in each row. Here the answers, I'm just going to show you the answer. In blurred vision can happen in retinal detachment. Blurred vision can happen in diabetic retinopathy. It can also happen in acute angle closure glaucoma, right? So you can see in the first row, it's not just one thing. You can actually have multiple responses. That's the matrix multiple response, right? So let's say somebody put, so how much, if this is the right answers, how much is the scoring? So you get 1 point here, 1 point here, 1, 1, 1, 1, 1. So total, the points which you can get is 1, 2, 3, 4, 5, 6, 7. Okay, 7 out of 7. That's what you could get. Now let's say instead somebody answered this. Let's say this is what somebody did. Okay, so what happens is you get the points for your, you got 1 point, you got 1 point, you got 1 point, right? But -1, -1, -1, -1. This is the explanation on that. We have already done this and it's already in the question bank too. So that's why I'm not explaining much, but you can see the answers. And this is the grouping. This is also there in our blog. the grouping way. I mean, it will be like in a table format. Sometimes you have to identify how many of there are there. So in this one, this patient, they selected the correct answers here, but here there was a wrong answer. And here also there was a wrong answer. So they ended up having that negative point. Total, they got only 3 points. So this is multiple response grouping. So here, rational scoring, and this is where everything must be correct. Everything has to be correct, okay? And this can be drag and drop, it can be drop down close, and on all those kind of drop down close, meaning, you know, when you click there, there's a little table comes and there is like options downneath. So those are drop down close and stuff like that. So those kind of answers might be there, but it will show you when you do the question in AppleRN question bank, when you do it, it will show you down rational scoring. Okay, so let's do one question real quick for that. So this is one of them, and most of the time it will tell you something like this is because of, or as evidenced by, or this is due to, you know, something which is like cause and effect kind of, like they're connected. So it's very critical thinking kind of process, and we need to know that to get the right answers. And that's why it's like rational scoring. So this one of them is like this. What do you think is this? The nurse see this on the monitor. The nurse understands that the ECG demonstrates and it's caused by and this is the best action to take. So you will have options there. So let's do this. This is what you get. Okay, when you click on that, you get all these options. So then we have to select from there. Okay. The nurse understands that this ECG demonstrates, only one can be selected. Sometimes it will be like drag and drop. Sometimes it can be drop down. So you just click on them and it goes there. That doesn't change the scoring. The scoring is still rational. So you have to get this right, and this right to get the point. Otherwise, it's 0. Even if you get this right and this right, but you got this one wrong, 0. And that's the rational scoring. Everything has to be perfect in that. So what do we think about that ECG? Is it dual chamber, arterial pacing, first degree block, pacing with failure to sense, pacing with failure to capture. So this is the ECG. And we discussed this ECG in our class. So you will see that there is a spike, right? You can see the spike here. And this is the spike, right? Pacemaker spike. And it's coming very regularly. So there is no failure to capture or failure to sense or anything like that, because it's going really good, right? Every time it's there. And it's always before the P wave. So it's an arterial pacing because it's always before the P wave. The pacing, then the P wave starts. Pacing, then the P wave starts, right? So this is arterial pacing, and that's why we can select the select that as our answer. We can select, say, it's arterial pacing. So that's one thing. And it's caused by, is it demand pacemaker or is it pacemaker malfunction? Is it electrolyte imbalance? We know that's not the thing. It's not pacemaker malfunction. It's not electrolyte imbalance. It's asynchronous. It's fixed rate, right? It's like every time, like clockwise. It's not on demand. On demand, meaning demand pacemaker is when the pacemaker will wait for the patient to start and see if the patient's atrial node is saying something or doing something. If they're not doing it, that's when the pacemaker is going to start. But this is like clockwise. It's always pacemaker, right? So this is going to be the asynchronous one. And then please don't feel bad about this if you didn't get it right, because maybe you haven't reached the cardiovascular session yet. If not, don't worry, you will get there and you will find it. And it's very, very simple explanation on ECG. And people usually tell me after they pass the exam or after the exam, they tell me that they were really hoping to get some ECG because they were so good in it, but they didn't get any. And they feel so sad that they didn't get any ECG. So you'll be really good by the by the exam over. And then the best action is, what is the best thing to do? We don't see any problem, right? There is no need to cardio word. There is no need to externally pace, because we usually pace when there is malfunction, but there is no malfunction. And there is no electrolyte imbalance, so we don't need any potassium at this moment. And no medications are required. So our answer is going to be continue to monitor. So you have to have this correct, you have to have this correct, and you have to have this correct. If all three are right, it's rational scoring. You get the point. If not, if anything is bad, like instead of this, if you selected this, 0 points. There is no negative marking, by the way. It's just either you get everything right and you got the point, or you got something wrong and you didn't get it. Okay, so that's the answer. Was that helpful? I know it took a little bit of time, but I'm really, really hoping that this was helpful. And I really wanted to spend the time with you to explain how to do that, scoring and help you with that. But so this is my last piece of advice. Prepare right, prepare well, so that you don't have to worry about scoring. Right? And that's the confidence you should be getting. It doesn't matter when you go there. It doesn't matter to you what kind of scoring is there, what kind of questions are there, because you are good with it. You are already prepared. You are ready. You have gone through all the questions. You have gone through all the question bank, practice exams, and exam mode. You have done your exit exam. You have your notes with you. You have written everything. You have listened to all the videos. So you're like so good that you don't have to worry about the scoring. And that's all I have to say. I pray for you. My blessings are with you. And may God bless you all.